I might not be sharing I might not be sharing my screen because I'm using a phone and then the orientation might not be that good. However, I'm going to be sharing the slides later. I hope that is very fine. Is that fine? Hello?
Can you hear me? Oh, sorry. I didn't know I was muted. I was talking. I said that will be very fine. And
All right.
also, if you share your screen and you put your phone to landscape, it also look very nice. But anyhow, it's fine.
Okay then. Let's see.
And welcome, Aliyah. I've been expecting you.
Can you see my screen now?
Yes, you can see your screen.
Um okay, so I'm using a slide that was pre-used in a place. So I said earlier that I'm going to be talking about quantitative and qualitative research methods. But tonight I'm going to be talking basically about quantitative research methods. So I don't think I'll need to reiterate all of this. I think Moses must have talked about what research is, and right. I want to believe that you all understand all of that. So let's just delve straight directly into the research methodologies that we have. So if we to take a look at quantitative um research methods, how do I know? How do I know when to use a quantitative research methodology or when to use a qualitative methodology? So we are going to find that out very soon. So when you're carrying out your research, please, can everyone hear me? I believe everyone can hear me.
Yes, can hear you.
All right. So when you're carrying out your research work, that's things that you have at the back of your mind, right? Are you trying to confirm something that has been said before, or there is an assumption that has been made before? Let's say, okay, your BMI is depending on there's an assumption that okay that your BMI is depending on your weight or your height. Then you really want to find out amongst the target population, say among under 5 children, you want to check if really their BMI is depending on their weight. It's something that has been predetermined, right? So we want to confirm that. What kind of research methodology are you supposed to use, right? So all I'm trying to say is that your research objectives, which I believe that Moses must have talked about, your research objectives and your research questions will influence what kind of research methodology to use. Your strength also will determine the kind of research methodology that you're going to be involved in. If you want to improve the quality of your research work, I mean, whatever it is that you're trying to do, you want to increase the quality, you can decide to use both quantitative and qualitative. Right? You can include both. So what sorry. So what is quantitative method
Oh,
in
sorry, sir. You can put your phone on do not disturb in case because of the notifications.
all right. Okay. Thank you for that. So I've been saying quantitative research methodology and all of those. So what is this quantitative research methodology I'm talking about? Just from the word quantitative, that's from the word quantity. You agree with me? Quantity has to do with anything numeric. Where we are trying to establish how much something is, or how many or how many. That's what quantitative method looks at. When you are trying to check numeric estimates and all of that. For example, currently we know that there is an outbreak of cholera, especially in Lagos State, right? And then they are coming up with numbers saying, oh, the prevalence is, I don't know, I'm making an assumption now. The prevalence currently is 20.1% in Lagos State. Have they come about that? It was because they've done some research work, they've carried out some findings, and then they're able to come about that. That kind of inference or that kind of findings is through quantitative method. They are trying to tell us that how much people that have been affected, how many people have been affected. That's what quantitative research methodology. One of the things that quantitative research methodology take a look at, right? So quantitative data measures the magnitude and scale of effect. Also, when I was talking earlier, I said sometimes something.
Sorry, sir. I can't see your screen again. Or can anyone see the slides? Hello?
An association between lung cancer. There's an association with hello.
So we lost you for
Somebody was
a
saying
bit.
something.
Yeah, we could not see your slides, and I stopped hearing you for a bit.
Oh, how
I
about
don't know
now?
if you just mentioned. Yeah, I can hear you now.
Can you see my screen now?
Yes, I can.
My goodness. And can you see my screen now?
Yes, I can see your screen. I can hear you now.
Okay, thank you. So I was trying to say something about hypothesis. So let's say, there is an association. We are stating a null hypothesis, saying, oh, there is no association between smoking and lung cancer. If that is what I'm interested in studying, right? This is a quantitative method in the sense that I'm going out. Let's say that would be probably a geospatial study. I'm taking a look at those people that smoked. At the end of the day, did they actually develop lung cancer? The number of people that smoked, how many of them developed lung cancer? The number of people that did not smoke soon, how many of them developed cancer at the end of the day? Is there a significant difference between the two? Then I can say, oh, okay, I think smoking is actually a risk factor for lung cancer. Do I make sense? Hello?
Yes, yes.
Okay, I just want to confirm that, I'm actually using a single screen. I want to confirm that you guys can hear me. All right, so to do something like this, usually um the researcher will use something called an observational checklist or a questionnaire. Let me try to show a sample of questionnaire here. Let me repeat what I just said. If you are trying to carry out a quantitative research method, if you are trying to make use of a quantitative research method in your research work, you are most likely going to be making use of a questionnaire or an observational checklist. And the questionnaire, for example, if you have a questionnaire, it's going to have about 3 different sections, in the sense that you are going to be introducing yourself as a researcher, what you intend to do with the research work, and why you want people to help you fill the questionnaire. I don't know. Has anybody seen a sample of the questionnaire before? If you have, can you just give a thumbs up?
So, hello?
Am I still audible, please?
You went off a bit and came back on. So, can you hear me? Hello? Is something wrong with his network or something. Welcome, Ikmat. Was anybody able to hear the tutor? Like as we were speaking. Hello? Can anyone hear me? Hello? Hello?
Yes, I can.
Yeah. Were you able to hear Joy before it got logged off?
Sorry, my network knocked me out. Hello, can you hear me now?
Yes, I can hear you.
I'm going to be sharing my screen again. So I think I was talking about the questionnaire earlier. So I said a questionnaire will most likely contain 3 sections. A section where you're going to be introducing yourself as the researcher, right? People want to know the person that is carrying out the research and your intention. Then there is going to be another section. Okay, the very first thing is your topic. The next thing is you introducing yourself and the intention of carrying out the research work. Then you can then have the questions that are going to be related to your research questions, your objective, what you are trying to do. Hello, I mean, using
Yes, I
this,
can hear you.
I can. Okay, thank you for that. And then if you are making use of a quantitative research method, if you are not making use of a questionnaire, you are going to be making use of an observational checklist. This is what the observational checklist does. Let's say you are assessing the healthcare, let's say primary healthcare providers practices of a tuberculosis case detection practice. All right. So we expect that they have an SOP that they use in carrying out their work at their workplaces, right? Oh, when a child is presented at the hospital, what is it that you should do to check check for symptoms of tuberculosis or something like that. So using an observational checklist, when you are going there, just from the word observation, you are going there with those information. What is expected that you find there, you keep it in a document. Then you go in there by observing. Oh, is this available? Do they have standard operating procedure manuals that they are looking at? Do they have a what is it called now? This gene expert machine, do they have it for confirmation? Do they have a chest x-ray lab? All of those things. By ticking them off, when they don't have it, you tick it out. You don't tick it. When they have it, you tick it out. So that's what an observational checklist does. So I said if you are using a quantitative method, you are most likely going to be making use of a questionnaire or an observational checklist. Your questionnaire is most likely going to be having 3 sections. Your topic, a section introducing yourself and why you are carrying out research work. Another section talking about the characteristics of the respondent. Another section talking about what you intend in finding, your research questions, your research objectives. Say that you are trying to take a look at knowledge of women attending antenatal care clinics on the use of supplements. Let's say that's what you are trying to look at. So there will be a section. The first thing to do is you label. Let's say you want to create a questionnaire now based on that topic. You are trying to look at the knowledge of pregnant women attending antenatal care clinic on the use of supplements, right? The first thing you have to do is make your topic known. That's the first thing. Just like I stated, you state that, then you try to put a section where you are introducing yourself. Oh, so. trying to carry out a search on this topic, and I ensure and I confirm to you that this information is going to be used for solely for this research work, something like that. That's intention about after your topic. Then the next thing that should follow it should be the characteristics of your respondent, most likely the socio-demographic or the socio-economic characteristics of your respondent, like their age, their parity status, their marital status, their occupation, and things like that. Things that you can use to characterize your respondents, right? Then the next thing will then be the questions that will check for their knowledge on the use of supplements during pregnancy. When I say supplements, like iron folic supplements, right? And some other things that would aid and help them with the development of the child that is yet to be born and the mother herself, right? So you put questions that will make sure that, oh, how much do they know about the benefits of IFA? How much do they know about going for external clinics for health education and all of those. Health education about supplements. We include questions that will measure their knowledge, that will test for their knowledge, right? That's what a sample of a questionnaire can look like. And I tried to explain what an observational checklist will look like to you. Although I'm going to be, I think in this slide I should have something that is depicting that. An observational checklist is just from the observation. You have a checklist with you. Then you are checking, you are observing whether those things that you have included in your documents, whether it is available or not. Oh, let's stick to this. Let's stick to the availability. Let's say availability of nutritional supplements in antenatal clinics. So when you get there, you look around. Do they even have IFAs? Do they have any other supplement that pregnant women can take? Just by observation is what you see that you're going to be thinking of. If you can't find it, that means it's not available. That's you don't ask them. You don't ask them that. Do you have, for example, let's say I happen to be a matron in a primary center, right? And then somebody comes around, coming with a book saying, putting an ID card saying you are from so place, and then you're asking me. Let's say normally in the health center, we don't even have these things that you're asking, but because you're asking me, I want to give credibility to my place of work. Once you ask me, I could say yes, even though we don't have it, just so that people can see that, oh, that clinic is one of the best places that it can be, right? But that's not what you do with observational checklists. It's what you see that you think of compared to when you're making use of a questionnaire. Questionnaire is going to be depending on whatever it is that they are giving you, whatever it is that they are saying to you. It's not what you observe. It's whatever it is that it is. I don't want to use the word subjective now. It's whatever it is they are giving to you that you record, right? So those are the instruments that I make use of when you are taking a look at quantitative research methodology. I hope we are clear on that. Hello.
Yes, sir.
Okay, so let's
Yes,
go
sir.
to the next. So I want to take a look at the strengths and weaknesses of a quantitative research method. When I started earlier, I said it is usually used in used in researchers where you need to talk about numbers, when you need to evaluate how much something is happening or how many. Basically numeric, right? Just on the word quantitative research methodology. So one of its strengths is that it can easily provide you with numeric estimates. An example is what I said earlier, like prevalence of cholera is currently ongoing, right? Another thing is that the data can be verified. You want to agree with me? Let's take HIV for an example. There are several record forms that they fill. Let's say, oh, you are just tested. There is a form that they are going to fill, whether you are reactive or not reactive to vitamin. If you are not reactive, are they carrying out any other tests? if the person is reactive, it's going to be done to confirm whether that person is really positive or negative. Those are going to be recorded. So if somebody else wants to carry out the same research work that I have done, he can retrace the data. It's something that can be verified. It will be difficult to get the exact same thing. Do you understand what I'm trying to say? One of the major characteristics of a scientific research is that it is reproducible. Whatever it is that you have done, somebody else must be able to pick it up, and then, if not something that is very, very similar, that will ensure that, oh, you have really done a good job, right? Another thing is that the data can be comparable between different communities within different locations. We are trying to make comparison. For example, now, I think the cholera is not just only in Lagos. I think there are some states in the northern parts that they recorded the outbreak of cholera, right? So, the prevalence now at Lagos State is now 18%. So I'm just making assumption now. This is not definite. The prevalence of cholera now in Lagos State is now 18%, while in Benue, let me just take Benue, is 2%. So you can really tell the difference. One is actually higher, right? That's one of the things that quantitative research method. As much as it has these strengths, there are some weaknesses that you cannot overlook too. And an example of that is gap information. What is this saying? You can only get the information that you have included in your questionnaire or your observation activity. You cannot get anything outside of that. It's going to be depending on whatever it is that you have included in the questionnaire. So their perspective, whatever it is that they think, is not going to be, it's not going to be reflecting. It's just what you want to know that are going to be finding out. I don't know if I make sense. Do I make sense with that?
Yes.
Hello, do you all get that?
Yes, I do.
All right. It's also a labor intensive process in the sense that, for example, now you are trying to find out the case detection practice of primary healthcare worker as regards childhood TB in Osun State, for example. So it's saying in Osun State, we have like about 730 primary health centers in Osun State. And I believe that we've been taught about sample. A sample is a perfect representation of a population. So if I'm saying in Osun State, that means at least we have 30 local governments in Osun State. So that means at least I should go to about 20 of them, selecting randomly, right? So that I can have a perfect representation of the population. So that means moving from so local government, let's say if it's local government to Oshogbo local government, it's very a lot of time, a lot of money. In fact, the resources that are going to be spending on it is going to be a lot. So that's one of the weaknesses, right? Another thing is time constraints, which I have said with the labor process as well. It's going to be taking a lot of time. Sometimes some of the people that I want to collect responses from might not be forthcoming. Some of them might tell you to come some other time and all of those things. So it's going to be taking a whole lot of time to gather your data. That's one of the weaknesses that you can get when you are making use of research, quantitative research method. So I think I've actually talked about this when we were talking earlier. I said one of the instruments for research, for quantitative research method is questionnaire. I'm going to be showing you. You don't need who invented it and all of those things. So this is a sample of a questionnaire. Just like I said, you are most likely going to be having like 3 sections. The first thing you can see is the topic: knowledge, attitude, and practice on TB prevention strategy among people living with HIV in Lagos State, Nigeria. That is the topic. So I said there's going to be a part where you're going to be talking about your intention of carrying out the report and then trying to get their consent, right? The purpose of this study is to assess knowledge, perception, and practices towards TB prevention. Information generated will be used for academic purposes only. Now you've established what you want to do and what their data is going to be used for. Don't forget that I believe that everybody on this call are medical practitioners. So I believe you are still in school and then you must have heard about data privacy, right? HIPAA. You should not disclose information of your patient or your respondent without their consent. So if you have taken their consent, right, there must have been something that you must have told them for them to agree on your consent. So you should not get out of that. Let's say it now. So asking them about their age, their gender, their level of education, occupations, and the likes. So that is you collecting some information about your respondents, some things that I think can actually be influencing that I believe that might actually be influencing their knowledge, attitude, and practice on TB prevention, right? So the next section will be on now. Before I go there, based on what Moses must have talked about, your research questions and objectives. So seeing this topic now, knowledge, attitude, and practice on TB prevention strategy among people living with HIV in Lagos State, Nigeria. So please, I want somebody to tell me what are the research questions that I can form from this? What are the research objectives that I can form from this? Is anybody speaking? Hello? Araba, do you want to say anything? Alia, do you want to say anything? Based on the topic I just talked about, knowledge, attitude, and practice on TB prevention strategy among people living with HIV in Lagos State, what are the research questions that I can form from that? What are the research objectives that I can form from that? Okay, since somebody is talking, let's just move. Yeah, I can. My research objective might be to determine the level of knowledge of TB prevention strategy among people living with HIV in Lagos State. That can be one of my objectives, right? So assess. I can also have this as an objective. Assess the attitude of people living with HIV in Lagos State as regards TB prevention strategy. That could be an objective. I might want to determine that prevention, there are TB prevention strategy. There are TB prevention practices. That might be an objective too. That might be something that I'm interested in finding out, right? So that will influence your other sections, the other sections that you have immediately after your respondent characteristics. So the very first thing that I might be including here will be the knowledge, followed by the attitude. So the section B now is saying knowledge regarding TB prevention strategy. And then the questions that I'm going to be seeing here, there are questions related that are going to be testing their knowledge on TB prevention strategy. What are the things that you know about TB prevention? Those are the questions that I'm going to find there. Are you aware of tuberculosis? Yes or no? Let's keep that. So who are those that are susceptible to developing tuberculosis? What are the signs and symptoms of someone suspected of having tuberculosis? This is basically talking about their knowledge about tuberculosis anyways. What are the names of drugs used in treatment of tuberculosis among HIV? This is more treatment and all of those things. In fact, this question now is not really structured well because it should, since your topic is all about the TB prevention strategy, not TB itself, not TB treatment. You should streamline into measuring their knowledge on preventive strategy actually, or prevention. And then the next after knowledge should be attitude towards prevention strategy. The next one should be practice of TB prevention strategy. I hope you all get that.
Yes.
Okay. Just like I've actually said, that what are the information that are going to find your questionnaire? Wait, I hope I'm not making assumptions that Moses had talked about those things that I was saying. Like Moses has rightly said, things like your objectives and research questions, because I saw you guys that were silent about it.
Yeah, it did. It did. But the people that we usually active in this class, they are not here. So I'm not sure.
Okay. So
Yeah,
that means that
that's
I'm
why.
probably have been making assumption. I assume that it's something that would have been taken.
Yes,
Anyways,
it has.
okay, I don't want us to be going back on that since that's taken. You can always I believe that this thing is always available for them to go over, right?
The recordings, yes, on the materials.
All right, all right. So like I'm just going to be repeating what I've just said earlier. I said the information that I'm going to find on your questionnaire will be we most likely going to be in three parts: the administrator information, the respondent characteristics, and the information as regards your research questions and objectives. So the administrator information is where you are introducing yourself, the intention of your research, and getting their consent, right? The respondent characteristics is where you are getting things like the socio-demographic characteristics of your respondents, the socio-economic characteristics of your respondents, probably their work history, things that will characterize your respondents, right? And the next section should be questions that can help you answer your research questions. Or you are interested in studying, still looking at this questionnaire now. Questions that will help you answer and help you check the level of your respondent knowledge on TB prevention strategy. That will help you assess the attitude towards their practices on TB prevention. Those are the questions that will follow after your respondent characteristics. This is an example of what an administrator information would look like. The person is trying to look at the knowledge, attitude, and practice on TB prevention among people living with HIV in Lagos State, Nigeria. So this is administrative information. I am a postgraduate student of LAUTECH University, LAUTECH, Ogbomoso. The purpose of this study is to assess knowledge, perception, and practices towards TB prevention. Information generated will be used for academic purposes only. Thank you. And person kept the link. This is you trying to make your respondents, your participants know you, right? And the next thing will be the respondent characteristics, just like I've said earlier. It could be their demographic information alone. It could be their social demographic information. It could be their socioeconomic information as well, right? Just like it has likely been, sorry, just like it is showing here, you want to know what their age is? I don't know. Okay, maybe we just talk about, and I'll tell you what to guide you when you are trying to build your questionnaire. How old are you? Gender, your respondent gender, your respondent level of education. This is the part where that would be included. I don't know if you are the type that usually read articles, like medical articles. You must have seen that. So when you are reading those articles, you are most likely going to be seeing the participants' characteristics first, coming forward first, talking about, the mean age of our respondent is probably 25 plus or minus 2.6, something like that. If they have not included something to characterize the respondent, they will not be getting informations like that, descriptions like that. Then the next thing will then be on the questions that we answer your research objectives. So information and research questions, just like I've rightly said, this is where you gather questions. This is where you gather information that will answer your research questions and objectives. So this is just, I'm just trying to give an example. Another example. Let's say you are interested in assessing knowledge, attitude, and uptake or prostate cancer screening among adult males in saying local government area or your state. So I need Araba, I think you have been on a call for a while. So I want you to tell me, what are the information that I should keep on my questionnaire based on this research objective? Is Araba still on the call? Does Aliyah want to help out? Does this mean that you not be understanding what I'm saying, or you are shy to talk,
Can
or
anyone hear
which?
him? Please, if you can hear him. Alright, can you hear him?
Are these people on the call, or it's just us?
Hello, hello, Alright, Aliyah, please, if you can hear, please respond. Aliyah, Alright, can you hear us?
I'm afraid these guys are not on the call,
Wow,
and then
wow,
you don't think there's a point proceeding, right?
that's very bad.
So I just hope
I'm
I've
so
not been
sorry.
speaking to just you and Mr. Paul all this while.
I'm even using Paul's account, so Paul is not here. I'm using his account to record this class.
Oh, so wow. I think we just spent the stuff here today. We can schedule for some other time when
Alright.
they are available.
Yeah,
And
because there are some
for the
people that are
topic I
usually
have
very
today,
active. They are not here. People that are always very active asking questions. So sorry, sir.
it's there's no problem. So we
Alright.
can reschedule for some other time.
Yes.
I'm usually available in the evening, so we can fix some other
Okay.
evening to proceed.
Alright. Thank you
All
so
right, so have a
much.
great
Thanks so much,
night.
sir. Yeah.
Yes, you're welcome, sir.